welcome to the African Emergency Room. Thank you for joining us today. Today we'll be talking about fractures. There's this diffuse belief in our society that fractures are not treated in hospitals. I don't know where it came from, but today we'll be looking at all these factors to know why this belief is the way it is, and is the hospital guilty of this belief? And then as a result of this, how complicated are the cases of fractures that are presented in hospitals? Unfortunately, the commonest cases that we see in hospitals are from bike riders and tricycle riders and the commuters they carry. And when they present, sometimes it's ugly. Sometimes they go somewhere else before coming to the hospital, and it's even uglier. I'm Dr. Lex. I welcome you to today's show. With me in the studio today is Dr. Ogochukwu.
Hello. To take us further in this discussion about fractures, we have a guest in the house, Dr. Olumide Adewakun, who has a wealth of experience in trauma and orthopedic surgery, and he will be speaking to us today about fractures. Welcome, Dr. Adewakun.
Thank you for having me on this show.
All right, so we'd like to know, what are fractures?
A fracture is simply a break or a crack in the bone. All right, and usually caused by road traffic accidents. By road traffic accidents, I mean car accidents, bike accidents, or accidents from these commercial tricycles, popularly called keke napep. A fracture could also occur from falls, which is common in children and in elderly. Fracture could also occur when you have a direct trauma to any part of the body. How do you recognize fractures? First, there's usually pain at the site of a fracture. There's swelling, there's difficulty moving that part. There's usually a twisting or a bent limb, especially if it's in the upper limb or the lower limbs. Also the loss of function of that part.
Dr. Adewakun, in your experience, what are the ways that a fracture or a person with a fracture would present in the ER?
They present in different ways. A lot of times, people with simple fractures present with pain and swelling of that part. Some other people present with what we call open fracture. An open fracture is when you have either a wound at the site of a fracture or a bone sticking out. All right, so some people just present. I mean, some are rushed in and there's blood everywhere, and they're like, "Doctor, help us, help us, help us." Then you see a bone sticking out. That's the way of presentation. Whereas some other people present with with complications from fractures. I mean, some of them have fractures and they go visit traditional bone setters first. All right, develop complications. What we call malunion, meaning the bone is healing in the wrong way, or a non-union, which means the bones are not touching or are not well aligned or well opposed. All right. Now, people visit traditional bone setters for different reasons. I think the topmost of the reason is pressure from family and friends.
Yeah, and it seems very common, very popular. People.
Yes,
traditional bone setters.
Yes, they're popular because first they are easily accessible. All right. A lot of people prefer to go to traditional bone setters. They prefer traditional bone setters to hospitals because when it comes to hospitals, you have to stay on the queue to get a card and all the whole protocol and all that, So they believe once they get to a traditional bone setter, they get immediate attention. Or immediate.
Dr. Olumide, let's hold it there. Right. We'll go for a quick break. Well, I'm very, very interested in these traditional bone setters, why they do that, why they avoid the hospitals, why they even believe hospitals can't help them. We'll come back to you. Viewers, we'll be right back. Welcome back to the African Emergency Room. Before we went on break, Dr. Adewakun was telling us about fractures, and he was telling us why some people prefer to go to the traditional bone setters to fix their fractures. I had said earlier in this show today that there's this diffuse belief. It was funny, Dr. Adewakun, I was in the emergency room one day, and there was this patient that was brought in with fracture. And the orthopedic surgeon came and discussed with the family after telling them everything that is involved, how the kind of injury the person had and what would be done. And eventually the person would need surgery. Open reduction and internal fixation, that's the name of the surgery to be done for him. And they all accepted. They were sounding fine. And then the surgeon went out. And then I was busy. They didn't know I could speak their language. I could understand their language. And then they were talking on the phone. and I would interpret. And they were saying, yeah, we've discovered that it's fracture he has. You know now, fracture is not treated in the hospital, so we're thinking of where to take him to. I said, wow. They just agreed to surgery just now. And they said, you know, fracture is not treated in the hospital. And then I've heard it over and over again, and I'm wondering, I see fractures being treated in the hospital every day. People get up and they go home. They are fine. And I wonder why this belief is still there and people keep going for these complications. I'm sure you will help us with this.
Yes, like I said, the first and the most important is pressure from family and friends. Just like you said, they had to make calls, and whoever they spoke with, asked them to probably take to a traditional bone setter. I've had a case of a young man who had an accident, a road traffic accident. He had a fracture on his lower limb. He was brought into the emergency room. And we spoke to him, we counseled him about surgery and all that. But his brother came in, and his brother wanted him to be moved to a traditional bone setter's, should I say, office or a center. All right. So I noticed his brother was walking with a limp. So I asked him, what happens to your brother? I said his brother had an accident a few years back. And I said, your brother is limping. He said, yes. I said, do you want to walk like that? He said, no. I said, okay, so you decide for yourself if you want to have a surgery in the hospital or you want to go to a traditional bone setter. All right. He made a wise choice. He made the right decision. There's a case of a boy, a 10-year-old boy, all right, who had a fracture. He was playing with his friends. He fell. He had a fracture on his upper limb. They took him to a traditional bone setter where some concoctions were applied. We don't know the source or the constituents of the concoction because most of their practices are shrouded in mystery. All right, so the concoction was applied, and also it was tied with some sticks and ropes. Now, when the boy came to the hospital, he had already developed what we call a compartment syndrome.
Wow.
All right. The compartment syndrome is simply when there's an increase in pressure in the limb due to a trauma, causing reduced or stopping the blood flow to the muscles and to the structures in that limb. The boy eventually lost some muscles and use of his hand, and is still on admission right now. So those are the things we see. Another reason why people prefer to go to the traditional bone setters, like I said before, was the easy accessibility to them. They're easily accessible. You don't have to queue. You don't have to register for buying cards. No one has to take your temperatures or take away your vital signs. Then another thing is the money. People believe it's cheaper to access or to attend traditional bone setters, than to come to hospitals. All right, but on the long run, unfortunately, traditional bone setters outcomes usually leads to either a loss of the limb or lifelong deformities, or sometimes death.
Could it also be one of the reasons that people go to a traditional bone setter? Could it also be because of poor education?
Oh yes. Yeah, I won't say poor education. I'll probably say enlightenment.
Enlightenment.
Okay, because a lot of educated people. In fact, I've seen a professor who presented in the hospital. Because of complications arising from him going to a traditional bone setter. All right, so some of these traditional bone setters these days do surgeries. Like there was a case of a young man who came to the hospital. We did an X-ray and found out a part of a bone of his foot was missing. So when we asked him, he said they gave him some injections, sedated him. He didn't know what happened. Then he woke up and found out he had pains, And then they told him they removed the bad bone. All right, so those are the kind of things we tend to face these days.
Can you help us and help those who may be first responders in one case or the other? It may be somebody's brother, it may be a wife or a husband or friend on the street anywhere, and there's just a fracture. How should we handle this to avoid further injury to the victim?
All right. The first thing you should do is be able to recognize a fracture. And like I mentioned earlier on, the characteristics or the features that you see or that makes you know, yes, this person has a fracture. First, there's pain, there's swelling at the site, at the fracture site, all right? Now, there's a twisting or a bending of that limb, and also there's difficulty moving the limb and loss of function on that limb. So the first thing you want to do is to calm the person down, reassure the person, make the person understand that you're fine, you're going to be all right, okay? We're going to help you, all right? Now you want to stabilize the fracture. Stabilize the fracture means you're using a splint. Now, being in an environment outside the hospital, you could improvise with splints. You could use cartons, you could use sticks, you could use planks, just anything straight and rigid, okay, to keep the fracture in place or the limb in place or immobile. Now, you could also, if you don't have anything to use, you could use the other limb. For example, if it's on the lower limb, you could tie the affected limb to the unaffected limb, okay, just to keep it immobile. Now, you should always note that, or you should keep in mind that you should immobilize the joints above and below the points of fracture.
Enough have been said, and sometimes we may not really understand all this, your joint above and below. We crave your indulgence to maybe show us a demonstration of what you're talking about.
Oh, right, sure.
So we'll be right back with a demonstration on what he has just told us.
All right, right here we're going to be demonstrating a first aid approach to fractures. Okay, for example, this young lady here probably sustained a fracture from playing football, and we're suspecting a fracture on the right leg. So remember, the features of fractures we talked about: pain, swelling, okay, difficulty with walking or with movements. All right, and also an abnormal twist or abnormal bend of the limb. So the first thing you want to do is to calm her down and reassure her. All right. Sorry about your accident. You're going to be all right. You're going to be fine. Okay. No first aid. I'm going to make sure you're okay before we get you to the hospital. Okay.
Okay.
All right. Just give me a few seconds. I'll be right back. Okay. Now the next thing you want to do is to get your splints. And like I said previously, you could use cartons, you could use sticks, you could use anything, to keep the whole limb rigid and immobile. All right? So here we have some planks you can use for a splint. So we're assuming that she has a fracture around this part of the limb, okay? Like I said earlier on, you're going to immobilize the joints below and the joint above each fracture. Okay, just like that. We get a cloth.
You shouldn't touch me around the fracture.
So I'm guessing that you can actually use any cloths at all, because this would be an accident scene or anywhere at all.
Oh yes, you can. Yes, you can use any cloth at all, because it's an accident scene. What we're doing is improvising at that point in time. The most important thing is you want to keep the fracture stable, so it doesn't become displaced, and so it doesn't become an open fracture. Now, in the case of an open fracture, like I said earlier on, an open fracture is when you have a wound around the fracture site or the bone poking out. All right, you could get a clean piece of cloth and put around that part to stop bleeding, okay? Then tie a bandage around it, all right? But in this case, we're thinking of a closed fracture. So once this is stable, okay, we can now you lift gently, all right? In one piece, you elevate, and then you call for help, okay? And try to get the person to a hospital where a cast will either be applied or the person will be scheduled for surgery, depending on, the severity or the extent of the injury.
So yes. This was what you were demonstrating before, what you explained before. You have to immobilize the joint below and the joint above.
Yes.
In that case, it will reduce the patient's pain.
Yes.
Okay, and you're sure there's no movement, therefore no injury to what we call neurovascular structure. That's
no further injury.
Blood vessels and nerves.
Yes.
Okay. All right, that's very good. So thank you so much, Dr. Olumide Adewakun, for this demonstration. And thank you, Ogo, for making yourself the dummy to use right here. Thank you so much. We'll be right back. It's been an interesting session today about fractures and what we see and how fractures are mismanaged and how they can be better managed. We understand that funds can be an issue, but you know that health is very, very expensive. But then deformity is more expensive. For a young person, for example, if you lose the use of your hands or your legs, then all the things you may need to do in your lifetime, all the things you may need to acquire may be affected. It is important to note what to do when there is a fracture, particularly as it is our topic today. One thing you need to know is that the Creator is a master craftsman. He created the body so that the body can heal. The body has great potentials to heal. So if your bone breaks and you're able to put them together and leave them in place for as long as healing will occur, the natural thing is for healing to start happening. So if someone has been lucky with traditional bone setters, it might have been because it was a simple fracture and the bones were put together and tied together without so much pressure in the tying, and the bones heal. For an adult within 6 weeks, for a child within 3 weeks, healing starts. Healing is almost complete. So you think you are lucky, you think the person has done a wonderful work. Naturally, you will heal. You're created to heal. Okay, but the problem becomes when things are applied and applied and applied and bacteria are introduced into an open wound, an infection sets in and someone gets to lose the limb, or someone gets to have an infection in the bone that may almost last a lifetime, what we call chronic osteomyelitis. Or a deformity sets in. Healing may not occur because of the infection that has set in. So it is very, very important to go to a hospital so that the right diagnosis will be made, and then plans will be set up on how to get the bone fixed. For some people, it's very easy. You just pay and it's fixed. For some people, that money is not easy to come by, but there are always ways to go about this. It is better to be whole than to lose your limbs when it can be salvaged. I hope this show has been able to help you today on knowing what to do with fractures, and especially even your neighbors around you, to warn people about how not to go about it. So if this show has interested you, you have a comment, you go to our website, africaner.com. If you have a question, you ask it there. If you have contributions to make to us, don't worry. We'll always read your response and you hear from us. Thank you so much, and bye from here.